Good day everyone, my name is Angel Arlibres from BSN 212C and I'll be performing intramuscular parental administration return demonstration. This is a way of administering the medication through the muscle which allows the blood vessels to absorb the medication quickly. This is done by inserting the needle at a 90 degrees angle at the muscle group such as the deltoid muscle, ventrogluteal muscle, and the vastus lateralis muscle. Before we start the whole procedure, we should first check the doctor's order and check the medication administration record or the MAR to make sure that the right medication will be administered to the right patient with the right dosage, with the right route of administration, and right frequency. Okay, since now I just finished checking the doctor's order and the MAR, the next thing I'm going to check is the label of the medication in order to make sure that I'm administering the right medication to the patient. Okay, also as I do this, I'm also checking the expiration date of the medication to make sure that the medicine that I'm going to administer to the patient is not yet expired. Now, we also should check the we should also take note of the 3 checks before administering the medication. First is to check the label of the medication after you obtain the medication from the medication card. The second is to check the label before you withdraw the medication from the ampule or the vial. The third is to check the label of the medication after you withdraw the medication from the vial or ampule. Now, the next thing you need to do is to organize the equipment. So, as you can see that the doctor's order and the MAR is already at my table. And also we have the medication ticket. We also have the tray, which I be using, medication tray I mean. We also have the ampule right here, which will serve as the medication for this demonstration. I have I'm having this 5cc syringe, which I be using to administer the medication to the patient. And I also have this 10cc syringe with a 21 gauge needle, which will be serving as my improvised filter needle since I don't have any filter needle. And I also have my cleaning gloves here. We also have a trash receptacle, especially the shorts receptacle. You have the alcohol in here. You also have our alcohol pad, which I be using in cleaning the ampule. You also have the dry cotton balls here. You also have the cotton balls here soaked in 70% alcohol. We also have our sterile gauze pad here that I will be using to cover the ampule as I try to crack it open. And now the next thing you need to do is to perform hand washing to deter the spread of microorganisms and to protect yourself from infection and prevent cross-contamination as well. And now the next thing you need to do is to prepare the medication from the ampule. And so yeah, the ampule is already at the medication tray. The next thing you need to do is to clean the neck of the ampule using an alcohol pad. So I'm going to take out the alcohol pad, discard, and then you're going to clean the neck of the ampule. Alright, so now that I have already cleaned the neck of the ampule, I'm going to discard the cotton pad or alcohol pad, sorry. Now we're going to take out our sterile gauze pad, which will serve as our protection for our hands as we try and open the ampule. So what I'm going to do is to pull down the ampule using my non-dominant hand. And I'm going to cover the head and the neck of the ampule using this sterile gauze pad. And then using like the dot in here, as you can see there is a dot. If not, then if you can see the dot in here, then I'll just I think try and attach a photo in here so that you can clearly see what I'm talking about. So I'm going to cover the ampule like that, and okay. Alright, since I already opened the ampule, as you can see, I have snapped the ampule away from me. Now, the ampule is already open, and the head of the ampule will be thrown in the sharps container. So I'm going to throw it in this area, like that. Now, the ampule is already exposed. We're going to take out our 5cc syringe, open also the 20cc syringe. I will take out the syringe from the 10cc syringe, throw it in the receptacle, and then unscrew the syringe from my 5cc, and then attach it to my 21 gauge needle. Make sure that the syringe or the needle is tightly attached to the syringe, to the barrel of the syringe. Now that we have already attached the 21 gauge needle to our 5cc syringe, we're going to uncap, and then what you're going to do is to hold the ampule to a flat surface, and then make sure that the tip of the syringe is not holding the ampule. Wait, I'm still having difficulties in trying to make sure that the syringe is at the center part. Going to withdraw the medication, since it is said on the medication that I will administer 2 ml of I will administer 2 ml of the ampule. So I'm going to withdraw the medication. Again, remember that your needle should not be touching the rim of the ampule. Alright. So now that we have already got the withdraw the medication from the ampule, you should since you can see that there are a lot of air bubbles from this syringe, so we're going to draw the air out from the injection, from the syringe. Okay. So remember not to recap the syringe from the cap itself to prevent any needle prick injury. Now that we have already prepared the medication, we're going to throw this ampule in our trash receptacle, like that. And now we're going to fill in the medication ticket. Write the name of the drug. So it is said here that it is paracetamol. So the dosage is 2 ml, and the route is on deltoid muscle. Okay. I'll put it right here. Also, before I forgot taking off the filter needles. Sorry for that. You have to take off the syringe, throw it in the trash receptacle, and attach the original syringe of this 5cc needle. Okay, so the medication is already prepared. So the next thing we're going to do is to enter the patient's room, and it is already explained on the very first part of this procedure that you should first check the MAR or the medication administration record. Also check for the 3 checks before administering the medicine, which is the checking the label of the ampule before you take it out from the medication tray, to check the label of the ampule before you start withdrawing the medication, and the third is to always to check the label of the medication after you withdraw the medication. To check the label of the medication after you withdraw it from the ampule, and then again organize the equipments. So I'm going to prepare the equipments that I'll be needing, which is the alcohol pad, the alcohol swabs. I also need the alcohol. But before we enter the patient's room, we should knock first and ask if we are allowed to enter the room. So let's assume that the patient have allowed us that we enter the room. So I'm going to put the materials that I'll be needing as I administer this medication to my patient. I also need my alcohol pad, my medicine tray, my alcohol as well, and I also need this sharps disposal. And now, since you cannot clearly see me, I'm going to adjust the angle of this camera so that you can clearly see the patient. Wait first. Also, let's not forget to perform again hand washing to deter the spread of microorganisms and prevent infection and cross-contamination. Since I already washed my hands, I'm going to pour some alcohol in my hands. My patient is I'm going to adjust it more. Hopefully, my patient is clearly seen in this position. So now, we're going to start by introducing ourselves to the patient and explaining the procedure so that she will have full awareness to the medication that we'll be administering to her. So, ma'am, good morning. My name is Angel Ardiples. I'm your student nurse for the day. Can I see your wristband, ma'am? Please state your full name and your birthday, please. Alright, so I think I clearly misheard your birthday. Please, can you state your birthday, please? Okay, ma'am. Thank you so much. And would you like me to call you, ma'am? Ma'am Camille is fine. Okay. Okay, Ma'am Camille. So, what language do you prefer speaking? Do you speak English, Bisaya, Tagalog? You speak 3 languages. Oh, so but you most of the time you speak Bisaya. Okay. And then I will speak Bisaya to you, ma'am. So karon, ma'am, Nako din sa imong atubangan kay mag-administer ko tambal sa imo. According sa imong physician, si Dr. Suarez, naghatag siya og doctor's order sa amuan. Nakabutang ito is mag-administer ni og paracetamol sa imong muscle dere. So ang buhaton nako is mag-inject ko og tambal dere sa imong bukton. After na maka-feel ka medyo mulmul dyan na imong kamot, imong bukton or dere injection site, pero normal na siya ma'am and mawala na siya later on. Pag administer ni Doc na kay kalintura, daw ka ma'am according sa sa doctor's order, kalintura daw ka bantog, giyakalan na paano para sa tangon. Okay. Okay po, sige. So magtusok og syringe yung unya ma'am. Okay na kasi ma'am. So after you have gained the patient's approval, we should provide client privacy by closing the windows and closing the doors. And the next thing we're going to do is to assist the patient in a sitting position. Since my patient is already in a sitting position, I'll just assist her to a comfortable position. So ma'am, comfortable ka sa position pa rin ma'am. Sige po ma'am, wait lang. Wait lang ma'am. Urong gamay ma'am ha. Okay. Sige ma'am, okay. Palikod na si ma'am o parong. Now, if the patient is uncooperative, you can ask for help to her guardian. So now that the patient has already sat, you can start selecting the injection site that you'll be using to administer the medication to the patient. So now I have decided that I will use the intramuscular site for me to administer the medication. So as I'm selecting the medication, so I should also be inspecting for any skin lesion, for any swelling, for any hardness or tenderness or inflammation or swelling that you can see from the skin. So I'm also going to wear my gloves, which serves as my protective equipment. I have also to touch my patient's intramuscular. If ever that there are presence of such things that I have already said, like lesions or hardness or tenderness in the area, then you should use the other site. For example, if there are presence of lesion in this area or any tenderness or hardness, then you can use the patient's right intramuscular arm or right intramuscular muscle. But if ever that injection is frequent, then you should not inject in the same injection site twice in a row. Now that I have already worn my injection, I'm going to check if there are any hardness or there are swelling in the deltoid muscle. Since I don't feel any bothering on the patient's intramuscular muscle, then the next thing I'm going to do is to take out my cotton balls soaked in 70% alcohol, and I'm going to clean the injection site using a circular motion from inner to outer to avoid contamination. So from inner to outer. Okay, and throw it on the receptacle. Now, the next thing you're going to do is to prepare the medication. So now, the first thing you need to do is to remove the cap of the medication of the syringe, holding it using your hand, your thumb, and your forefinger, like in a dark angle. And I'm going to place a cotton ball between my third and fourth finger, and I'm going to pull the skin to the side of the area, like that. I have my cotton ball in my between my third and fourth finger to be ready just in case needle is already withdrawn. So now I'm going to hold my syringe like this, and I'm going to insert it with a 90-degree angle. That. To check if ever you have you hit the bloodstream, then you can aspirate by pulling the plunger for like 5 to 10 seconds. If ever the blood appears in your syringe, then you have to withdraw the needle with the syringe and prepare a new medication. And then since if you don't see any blood on the syringe, then you can you can administer the medication steady and slowly. Okay, now that I have already administered the medication, I'm going to remove my syringe at the same angle the way I inserted the syringe to relieve discomfort. And I'm going to insert the cap of the syringe, and again I'm going to apply a gentle pressure in the incision site. So again, I didn't recap the syringe. I just did the fish hook method, and after that, I did apply a gentle amount of pressure in the injection site. And if ever it is like really bleeding, you have to apply really amount of pressure in the injection site. Then, after you administer the medication, you should tell the patient not to massage the area because it might because the absorption of the medication into the bloodstream may not that be effective, and there might be possibilities that the medication might go into the layers of the skin. So ma'am, after na ko administer ang tambal na medyo mulmol na siya ma'am, pero ayaw na siya i-massage ka, kaya na yung possibility na dili kayo ma-absorb sa bloodstream nimo sa inyong bukton ang tambal. So, sabihin na to, dili kayo siya effective. And also, kasi na yung possibility na imbis madto sa muscle ang imong tambal, kaya basig madto siya sa skin nimo. Para paspas unta ka maayo ma'am. So ayaw lang jud ma'am at any cost ma'am, ayaw lang jud siya i-massage. Ayan ba lang siya ma'am, mulmul na siya una pero mawala na siya later on. Okay. If ever you're injecting on the ventrogluteal muscle, you should wait for at least 5 seconds. For at least 5 to 10 seconds before you withdraw the needle. After that, you're going to discard the needle on the sharp receptacle, and then you're going to make sure that the patient is comfortable before we leave her in the room. So ma'am, musta naman ang pakiramdam ma'am? Medyo muli-mo ng injection, inanay siya ma'am. Explain naman ako ganina sa inyo but again, mulmul lang na siya una pero mawala lang na siya dito. Before kumuha, napaka-question ma'am. Wala na po. Sige, magbalik lang ang tugyapon si Dr. Ma'am para ma-monitor ka from time to time. Then, if ever na kay questions ma'am or na may concern, pwede i-ask ko or pwede i-ask may mga nurses dito sa nurses station sa imong kauban na guardian. Since naman may kauban na guardian, tao lang siguro that's why nawala siya. Okay po. Okay, ma'am. So, ano na kung mamahal, tagal natin kag time karon para mag-rest. Baka gusto mo maghiga, ma'am. Ayaw mo humiga, ma'am. Okay po. Magupo ka lang po. Sige. And after that, what you're going to do is to take care of the materials that you have used. And then, what you're going to do is to remove the working gloves that you have used on this procedure and throw it in the trash receptacle. And then, what you're going to do is again to perform hand washing procedure to deter the spread of microorganism and to prevent infection and control and prevent cross-contamination. Also, this is a way of washing our hands to remove any bodily fluids that have come in contact with our skin as we did the whole procedure. And the next thing we're going to do is to document everything that you have done to your patient, and also document the abnormalities or things that you have found in your patient if ever there is presence of that. So you're going to note for the name of the medication, the time where you administer the medication, the dosage of the medication, the route of administration, and the frequency of the medication. Also, you have to check to take note if ever there are any tenderness or any hardness or lesion or any swelling or inflammation in the area. And then the next thing you need to do is to wait for the effectivity of the medication that you have administered to the patient. And that's all for intramuscular parental administration return demonstration.